I ask you please all to accept the message that just appeared. Okay. So, welcome everyone. This is our second webinar of our project Saúde para a Comunidade, Health for the Community. That is a project promoted by PMA and financed by Barros Saudáveis. And in this webinar, we are going to talk about the access, in this case, the difficulty of access to healthcare services. And this is our program for this webinar. So it's going to be divided in 3 sections. Actually, the first section will be talked about by me. I'm Sofia Fonseca, and I'm a linguistics and literature student in Faculdade de Letras in Lisbon, and I'm also a Portuguese as a second language teacher in PMA. And then we're going to have a second part, that is the difficulty in the access to healthcare services for undocumented immigrants by Cecilia. I'm going to let her introduce herself when her part comes. And then finally, we're going to have an open space for questions and comments, whatever you want to say. I'm sorry. Okay, so in this case, let me start then. Once again, my name is Sofia Fonseca, and I'm going to talk about the difficulty in the access to healthcare services because of the linguistic barrier. In this case, I am focusing the study I'm doing here and what I'm going to present. I am focusing mainly on South Asian immigrants because for 2 main reasons. First of all is the community in terms of immigrants that I know best, because most of my students are South Asian, and that's the community that I've been working with for the past 3 years. So in this case, first of all, I wanted to explain something that is normally misunderstood. That is, Portuguese is not an easy language at all. Portuguese is considered a semi-opaque language. I don't know if I'm pronouncing this correctly, but that basically means that we have a lot of words that do not conjugate with the sound. So not every word has a specific sound just because of the way it's written. And also because of the way we talk on a daily basis, because of the way our speech is done. There's also a possibility of us being misunderstood a lot of the times, and people not understanding correctly what we say, because we are in this country we speak really fast. Some people more than others. I'm absolutely a person that speaks really fast, and actually in the beginning of my classes I always tell my students, I am sorry, I know I speak very fast, so if you don't understand anything, please, if there's anything at all you don't understand, please let me know and I will explain it again and again if it's necessary. But we are a country that speaks really fast. We have a lot of sounds that are considered in a way closed sounds. So when we speak, if we close our sounds even more, it's more complicated for people to understand what we are articulating when we are speaking. So that makes Portuguese a very complicated language. In comparison to us, we have, for example, another kind of Portuguese that everyone knows very well here, that is the Brazilian Portuguese, which is a lot different in that aspect. They also speak fast a lot of the times, but the truth is that they open their vowels more, they open their sounds more. So that makes it easier to understand, that makes it easier to get everything they are saying. So in this case, that is an idea wrongly that Portuguese is an easy language. It is not. We think that Portuguese is an easy language because we were born with this language. We grew up hearing this language. We learned this language since we truly were born. So it's easy to think of a language as being an easy language and for a forthcoming language if we learn that as children. I am sure, for example, people that speak Mandarin, that is a language that is highly difficult with a lot of different characters, thousands of characters, and a lot of different sounds in the same grapheme. So the same in this case, the same characters. Only with that, we might look at Mandarin and think, oh, this is a very difficult language. But if we talk to someone that is 40 years old and has spoken Mandarin in their whole lives, they will think Mandarin is easy. That's what comes with the fact that we learn this language since we were children. So it's a very misunderstood idea that Portuguese is an easy language. It is not at all. And that's what I wanted to start with. So, as I said in the beginning, I teach Portuguese as a second language to South Asian immigrants now for 3 years, and I wanted to just explain something here and put an idea forward, just so everyone can understand. That is, in Portuguese as a second language, and the levels I teach are levels A1 and A2. We have courses of or trainings, whatever you want to call it, of 150 hours. That's an average of 18 days of 8 hours classes. And in those 150 hours, we are supposed to give, between other things, because we have a really long program for the 2 levels. 2 levels, 3 modules each, so it's 6 modules in total. We have a really long program, and the truth is that between everything we need to include in our classes, in our teaching, we need to say, we need to teach the students a lot of vocabulary, obviously, the kind of conversation we have, so sentence structures and everything, all the verb tenses in terms of conjugation, so the conjugation of the verbs, we are supposed to teach them all the verb tenses. And also one thing, I'm sorry, I actually have a typo here, but one thing that we are also supposed to teach them, obviously, because it's a basic part of our language and it's a basic part of the understanding of our language, is all the sounds, in this case phones or phonemes, of the Portuguese alphabet. And just to give you just a very short idea, and this is based on linguistics and phonetics, so I'm not going to bore you with that. I'm just going to give you a very small explanation. Graphemes is what we call traditionally letters, okay? And phonemes or phones is what we call sounds, the sounds of the language. So in terms of graphemes, so the letters we have only 23 letters in the Portuguese alphabet. But when it comes to phonemes or to phones, we have actually 14 vowels, not 5, 14, and more than 20 consonants. When I say this is, for example, the letter A, for us is not only, we in Portuguese say A, okay, the letter is the letter A, but we don't only have the sound A for the letter A. Everyone knows that we have the sound A, and so many more. And we also have actually words that we don't even pronounce the letters. So graphemes and phonemes are very different things. And in those 150 hours, one thing that students need to understand very well is basically the difference between the graphemes and the phonemes. Not obviously, I don't teach my students what a grapheme is and what a phoneme is, but I need to teach them all the sounds of all the letters. Otherwise, they will not understand half of the words I give them in terms of vocabulary, which is absolutely, it's indispensable to teach them that. So it's normal that if we see, sorry, give me a second. Okay. it's normal that if we see that for people to have the level A2, which is the level A1 is the most basic level of a language, the level A2 is the second most basic level, and actually immigrants have to have the level A2 to ask for citizenship. But the truth is that in 150 hours, it's very, very difficult for us to basically be able to teach everything we should teach, because they are, although no one actually teaches that, I don't know any teacher of Portuguese as second language that teaches all the program, because it's nearly impossible. But they are basically asking us to cram in 150 hours the same thing that children learn in about, I would say, 7 years of Portuguese in school. So from first grade to 7th, 8th grade, which is a lot. And we cannot expect immigrants that come from a different background with a different language that normally comes from a different family of languages to basically be able to just out of the blue understand every sound and every word we tell them. This is a very important thing in this situation. Now, what I would want to, I'm sorry, what I would like to show you is a linguistic barrier questionnaire that I did, and I asked quite a few people to fill it out, so I could have a basic idea, so I could show you today what most of them said, specifically about Portuguese as a language, and about their understanding of Portuguese, and finally about the Portuguese healthcare system and how they've been treated because they didn't know or understand Portuguese, and so on. So in this case, in this questionnaire, the people that I interviewed were all South Asian immigrants. Over 90% were male. Nearly 50% had master's degrees, and 43% have been living in Portugal from 1 to 3 years. Another 43% have been living for 4 to 10 years. So an average of 5 years living in Portugal, and 71% moved to Portugal for work. When I asked them to rate me from 1 to 5, their knowledge of Portuguese, what happened is that they had very poor knowledge. And once again, I did not rate this. Everyone rated for themselves what they felt from 1 to 5. That was their knowledge of Portuguese. And when I asked how well do you understand Portuguese, 47.6% of them rated 2 from 1 to 5, from 1 being nothing at all, and 5 being I understand everything. In this case, I speak fluently Portuguese. In this case, from how well do you understand understand Portuguese? 47.6% graded themselves as 2, so nearly nothing at all. And I'm going just to remind you once again, we are talking about people that have been living here for an average of 5 years. So that this is a lot of people. This is almost 50%. And when we asked how well can you speak Portuguese, 52.4% also graded themselves as 2, which is even more, which is not a good thing. But I honestly don't think in most cases that is actually their fault. We do have a difficult language, and we do have bases in this country for a long time that we shouldn't, not that we shouldn't, I'm sorry, but that we don't give as easily help to those who need to learn our language. We don't give them the help we could for them to learn better our language. When I asked a simple question, that is, what is your Portuguese knowledge in general so far? Let me just accept something here, okay? When I asked, what is your Portuguese knowledge in general so far? Basically, 42.9% of the people said, I just know some greetings and basic vocabulary. 23.8% said I can actually maintain a conversation, and no one said I can speak fluently, which is honestly worrying. But once again, we could go back to the beginning of this presentation where I said Portuguese is not an easy language. So I do understand that. I wanted also to make to say one quick thing before I go on, and I'm going now to enter the part where I'm going to talk about their reactions and their experience with the healthcare system. And I would like to say this very clearly, I do not intend at all to downgrade anybody's work or service, or even downgrade any kind of any immigrants or what they do for our country or how hard they try to learn our language. I'm merely presenting facts that are important for this investigation. So going on. In this case, the first part of the healthcare system, I asked them a very simple question. How would you rate your experience with the healthcare system? I gave them a lot of options. I gave them terrible, so-and-so, good, excellent, and terrible, bad, so-and-so, good, and excellent. And although 52.4% said that it was good, which is good, 19% said it was terrible. And I think even 1% saying it is terrible is not a good thing. 19% is definitely worse than that. From everyone that answered the questionnaire, 67% of the people went with someone that could translate for them, so someone that could help them understand better what they were being told. Although this happened, I can tell you that only 22% of the people that answered this questionnaire said that they never felt frustrated, dismissed, disrespected, or even insulted because they didn't know or understand Portuguese, which is very worrying because we are talking about human beings with feelings that are doing their best and that are going to healthcare systems to ask for help because they are not okay or because they need it. It honestly doesn't matter why they are going to the hospital or the healthcare center. They are doing it because they need it, and they should never be treated or feel any of these options when they go there, just because they don't know or understand the language that is spoken in their country. And also 55.6% of them have been ignored by the front desk because they didn't understand or know Portuguese. Once again, this is a lot of people, and a lot of these cases, for example, they could have not even been going there to have an appointment. They could just go there to get registered and to get a UTENT number. So there are so many things that could happen, and a little bit of help would not hurt absolutely anyone. And let me go on. Then I asked two questions that were, when you went to a healthcare center, a health center or a hospital in Portugal, did people try to communicate with you in English, French, or any other mid-ground language? And 33% said none of them did that, which is, I don't know exactly how to explain how I feel about this, but I could understand the fact that no one is obliged to know more. I'm sorry, I'm blanking. No one is obliged to know other languages other than their own. Although if they are in a service that attends other people, maybe they should, but that's not even what worries me the most. What worries me is the other sentence, that is, when you went to a healthcare center, in Portugal, or a hospital, did people try for you to understand well the information given to you? And 39% said none of them did. This is very, very worrying. Because if you go to a hospital or a healthcare center, you are supposed to understand exactly what people are saying to you. If you have a disease, you want to know exactly what you have. If you have to get treatment, you have to know exactly what treatment you are going to have. And if we are talking about someone that speaks Portuguese and the other person only speaks another language, even if they don't speak a mid-ground language, then I don't know, use sign language. Honestly, this is something that cannot happen because people need to understand all their information clearly. And this is a big way to show that it is actually very worrying the way that the linguistic barrier is complicating the healthcare system and the way immigrants are treated in the healthcare system. And with that, I get to this sentence that is how I'm going to close my presentation and then move to my colleague Cecilia. Is a very well-known Portuguese sentence. Anyone that is Portuguese knows this sentence. That is, estamos em Portugal, fala-se português, or fala português, which means we are in Portugal, speak Portuguese. Well, honestly, and I'm going to be very blunt saying this, I think I always felt that this is a very arrogant statement. And I think this why. And once again, I'm going to say I am speaking mostly about South Asian immigrants. And I heard this a lot working in the association. I heard it a lot, for example, people that were going to the association to deliver something. And I said like, I said to them in Portuguese, oh, I can help you, but if you want to talk with one of my bosses, I just want to let you know they don't understand so well Portuguese, so if you could speak in English, it would help them. And a lot of people looked at me very arrogantly and said, estamos em Portugal, fala-se português. Which is interesting, because we are talking about people that do not speak English as a first language. They speak English as a second language. South Asian immigrants come from Bangladesh, India, Pakistan, Nepal, etc. And all of them have different mother languages, have different base languages. They speak Bangla, they speak Urdu, they speak Hindi, and so many more. So English is a second language to them. They are not coming here and speaking to you in Bangla, in Hindi, in Urdu. They are not. They are speaking in English because it's a mid-ground language. It's a language that a lot of people understand. That is the most global language we have right now. Although, yes, we have less speakers of English that we have of Mandarin, for example, but it's because of the Chinese population that everyone knows it's very big. The thing here is we need to be less arrogant and less pedantic about this and understand that they are coming to a mid-ground to meet us. It doesn't hurt for us to meet them there. It doesn't hurt at all. And if we do that, maybe we could have better systems in Portugal, and maybe people would be better treated in Portugal, and they wouldn't go through situations, like I said earlier, of feeling frustrated, dismissed, or even insulted and disrespected because they didn't understand the language. This is a very serious situation, and I just hope in a way that this webinar can open the eyes of possibly people that work in a healthcare system that come to see this. No one from that is here, from what I know, works in a healthcare system, but I just hope that someday someone sees this and in a way they understand that they could meet these immigrants halfway and it wouldn't hurt them. And with that, I'm done. Thank you so much. Cecilia, I'm going to move to you, and Cecilia is going to introduce herself and to speak about her topic, which is, go ahead. You are muted. Still muted.
Now you can hear me, I suppose.
Yes, yes, I can.
Thank you. So my name is Cecilia Mendoni Luis. I'm a student of PhD in ISCTE-UL, and I'm a researcher from CRIA, the Research Center of Anthropology here in Lisbon. And I would like to present the situation of undocumented immigrants, but focus on the immigrants. And I will start with Beatriz Padilha. She's from ICS, and she says that the lives of the immigrants are usually focused on work, meaning health as such is rarely thought as a central of their lives. It is often assumed that immigrants are healthy people because the strongest and most resistant immigrate to work. However, they are seen as carrier of disease that is threatening in the public health of the rest of the inhabitants. But none of these interpretations start from an integral vision of the immigrant as a person, in which health is one of the central aspects of the individual. So to start, I would like to say that I will speak about undocumented immigrants, but talking about health and immigration brings up some contradictions. On one hand, everyone has the right to health regardless in their situation, realize it or not. On the other hand, there are a lot of requests of help and complaints about the difficulties in accessing to health in Portugal. Like the other dimension necessary for the well-being and social-emotional balance, housing, employment, or access to education, health is the basis of the physical and mental well-being to which everyone should be entitled. A consultation or an exam, and when I speak about the consultation, probably I would like to speak about seeing a doctor or doing an exam should not be postponed under the penalty of having repercussions in people's life. My research on the living conditions of undocumented immigrants predates the first confinement of March of 2020. At the time, the difficulties in assessing health care of immigrants and refugees were already documented. We are not just talking about the language barrier and the inability to understand, but difficulty of understanding the functioning of an administrative machine that responds according to what the law provides without presenting alternatives. It has been prevented that health problems and the lack of the access to health service can constitute a fundamental and permanent obstacle to the integration, impacting almost all areas of life and influencing the ability to enter the labor market and the system of teaching, learning the language of the host country and interacting with public institutions. Particularly in the initial reception phase, it is essential to ensure the access to health care. But third country nationals may face specific problems in assessing regular healthcare service, adapting to the unfamiliar healthcare systems, and effectively communicating with healthcare staff. This is a part of the communication for the European Commission to the economic counseling, European economic counseling. To exemplify the situation, I present you the story of a refugee start. It's not the story of one undocumented, but it's also a migrant. It's a boy from Guinea-Conakry who had the residence permit for humanitarian reasons and who was sick, and he had the contacted me 1 week, and in the following week, despite having gone to the health center 3 times, he still had not been seen because they did not give him an alternative that would allow him to be evaluated by a doctor. So he did not saw the doctor. And he was in pain. When I spoke to him and asked him about this matter, he told me that he had given up on going to the doctor and that he hoped the pain would go away. How can we wait for a pain to go away without going to a doctor, without medication, without exams, even without knowing what's happening with the body. Waiting for the pain to pass can be something that be aggravating the condition. Failing to diagnose is something that can be more worrying with all its consequences. So not going to a doctor, it can be something not connected with being with health because it's going to pass. Probably it's not going to pass. But when we talk about people who are not seen in research appointments, we talk about people without access to exams, to routine appointments, and in the pandemic situation that we face, accentuated some problems and brought others. The lack of child health consultations, for example, the appointments, brought with all the consequence of isolation, several requests for referral to development evaluations. The lack of monitoring, follow-up, and referral of the most doctors to provide support during the pandemic reduced these consultations in the national service of health. And those family doctors already had a large number of users, reducing the service and the response capacity. But we are going to divide the regular immigrants from the irregular here. The different dimensions of the problem cannot fail to accompany the delays in the process itself. Serviços Estrangeiros e Fronteiras, where those immigrants who manage to regularize themselves ask for a user number from SNS, the National Health Service, which does not happen with regular immigrants, who even with the process under evaluation do not have access to the same number. Here is a big difference between those who can book an appointment or exam and the rest who are not regularized or are undocumented immigrants. With the pandemic and for the public health reasons, it was necessary to create a temporary regularization to all the people who had contact with the CEF, but only to the people who had contact with the CEF. Whether to make requests for regularization or renewals. Only this way these people were able to have benefits when companies started to enter in layout, and the poverty, the cases increased, came up. And we began to see homeless immigrants eating in the canteens without a job and stuck in a country where they can live. They couldn't live. Without documents, without a user card, we have people who were left in a limbo, unable to pay to go to a doctor or exams, living a daily life in the margins of the society. Another example is the situation, the story of a mother, 6 months pregnant, who was not seen for prenatal consultations because she did not have a residence card. She had to go to a private hospital for an ultrasound, and there the doctor prescribed several tests that she did not do because she did not have economic resources. We have from the state the information 25,360 of 2001 from 12th of December, and it says, has therefore determined and clarified that foreigners legally residing in Portugal have access on an equal basis with beneficiaries of the National Health Service to healthcare and assistance from the institution and service that make up SNS, the National Health Service. Also, under the terms of this order, foreign citizens in Portugal for more than 90 days can access to the health service upon presentation of proof issued by the parish council. The existence of this period will let the EOM, based on the MIPEX, the International Organization of Migration, and the health trend to identify Portugal as an example of a country where the SNS still does not cover immigrants during the first months to discourage health tourism. Can we speak about this today? This information is from 2016. Can we speak about the health tourism to Portugal? Are we so good for the immigrants and for the people who came from outside to have a health tourism? And the other part says that undocumented immigrants will also be able to access the SNS, complemented with the case in which denial of service would compromise urgent and vital care. The fees paid in SNS vary in Portugal depending on the discount made for social security by the citizen age. Under 12 years old are totally free. They can go to a doctor and they don't have to pay. And the reason for seeking the SNS for sexual and reproductive health, pregnancy and puerperium, family planning, legally defined chronic disease. We have this from Diário da República. It's the information from the state. But the service depends from who's in front of the administrative service. The integration also involves dealing with these issues. They are not just benefits, but can often be public health issues. That's why I presented as my first case a refugee from Guinea-Conakry, waiting for the pain to pass. But if this pain or illness does not go away, on the contrary, there is an aggravation that has great costs for him and for the National Health Service also, because they both are going to pay concerning his health and the hospital, because he will need to be there and he will need to have care. And so it's better to ensure that people have the conditions concerning health. The law says that everyone must have access to health also, but the problem often involves the lack of information from who answers, where to go, who to talk to, what documents to take, are not informations given to the immigrants. Connected with the language barriers and the lack of the dialogue, lead to a wide route to deal with a situation that treated can prevent more serious consequences. And now I will speak about the same, I will have the same speech that Sophia had before, is that everybody says in the public service, you're in Portugal, you have to speak Portuguese. And this is a test that I listen more with undocumented immigrants, but also with documented immigrants, and even with refugees. You're in Portugal, you have to speak Portuguese. But speak Portuguese means so much, and it's something so big. The idea to speak Portuguese is not like going from Portugal to Spain and speak Spanish, because it's a similar language. It's something different because we are speaking about people with different origins. It's often mentioned to me by the immigrants. You're in Portugal, why don't you speak Portuguese? You should speak Portuguese. You don't speak Portuguese. But we need to think that some of them are newcomers, and some of them don't even work connected with the Portuguese society. They are working in an ethnic service. So probably they are speaking their own language between them all. When they are treated in public service without considering the learning, that learning a language can be difficult even for us. I don't speak German, and probably it will be something very difficult for me to start learning a language and after 3 months know how to go to a public service in Germany. Not being an obligation on the part of the state service, it would be beneficial to know that there are speakers of other language, and that depending on the mother tongue, they have Greater or lesser difficulties in learning Portuguese. We can exemplify the situation even without living in Europe. And Sofia can confirm me this because we are both Portuguese teachers. I have been and she is. English students have more difficulty mastering Portuguese than, for example, people who are from Moldavia. We have that difference. And we understand that for someone who is an English speaker and has as a mother tongue English, and who live it always in UK, arrive and stay in Portugal and start learning Portuguese, it's difficult. It's not easy as an Italian speaking Portuguese, as someone from Moldavia speaking Portuguese. And all that difference that we face day by day when we have classes and when we are in contact with the students, we learn that geographical difference and mother tongues define who will learn and how the process will occur. My son doesn't speak. Other situation not concerning with the language, but getting back to the health problems. My son doesn't speak and he does not respond when I call him. This is something that one immigrant father told me. Children who were born during the pandemic bring a new perspective of what in anthropology we say is be in relation, to be connected, because we are humans. And as human beings, we need to have social networks. We need to be, we cannot live alone. This is not good, even for our mental health. The much needed interaction at the stage of a baby, of a really a toddler, in this stage with the world around them and with the people approach to the baby and younger children, is a part of the relationship with the world. The baby disconnects a little bit of the mother and he looks to the world. He needs to see people. People need to contact with them. And the COVID and the pandemic situation was something that cut all what they have about the connection with the world, because they were closed. Saying goodbye or smiling, something that we cannot do now because we have masks. We don't have contacts with the others, even if we don't know them. It was usual to people to smile, to say hi or say bye, something, and the babies are in connection with the world. No, they are not. This whole approach was lost because of the precautions during the pandemic confinement, and the children were at home, not only outside the little, they were outside a little bit, but they were living in the domestic space with the parents and with all the problems that the confinement brought. But also the situation was not just bad for the parents, it was really bad for the kids, because it broke the social interaction so necessary for the development. For these children, is a part of the learning process of social skills, and it has been postponed. This whole process is part of learning to live in pandemic, and the consequence of living the parent. The consequence of this situation leave the parents with insecurity, feelings of being bad parents regarding the development of their children. If in the case of regularized people, the regular immigrants, scheduling a child health consultation was difficult. For an unacquainted parent, this consultation often did not even exist, but legally it exists, because these kids can have an appointment. But the bureaucracy prevents many from being seen. either because they no longer live in the same address and there was no way to transfer them from a health center, for example, or they were not seen at all because the doctor had no agenda. Another situation is related to the fact that undocumented are really marginalized. Don't you have documents? This is something that usually you can hear in a health center. Don't you have documents? So what are you doing here? You cannot be served here. Get your documents and then come back here to register. It looks so simple to have documents. Even if people are working and paying his taxes, it's not easy to get documents. It takes time. But dealing with documents depends on this waiting. The disease does not wait. When we speak about public policies for immigration, we should think that those who work and contribute should have access to healthcare. In the same way, publicity measures should be created on the access of the undocumented immigrants to health, so that hearing people say it depends on who answer can no longer be part of everyday speeches and also of my field work. Thank you so much.
Thank you, Cecilia. So just to close up before we open a space for questions and comments, we would like to announce that 2 weeks from now, on January 26th, at 6:30 p.m. we are going to have another webinar. In this case, the speakers are going to be Dr. Farsana, there is a medical doctor, a gynecologist and obstetrician. There is the doctor associated with our project, and Israt Jahan, which is the nurse associated with our project. And the topic is going to be COVID-19, specifically the Omicron variant and its effects on different people. The link to access this webinar is the same. So if you have the link for today, you can just save it and use it 2 weeks from now, because it's exactly the same link. And finally, a little announcement, that is appointments in person and online with Dr. Farsana. We are going to start on January 19th, so in 1 week from now. You can book your appointment in our website, www.saúdecomunidade.tk. So thank you so much for listening. Here are our contacts. And we are going to paste them in the chat room if you want to save them. And now I'm going to stop sharing, and I'm going to open space to questions and comments, either to me or to Cecilia. And as I said previously, although this whole webinar wasn't in English, if you are not comfortable speaking in English, you can always ask your questions or make your comments in Portuguese. It's absolutely fine.
Well, if you would like, you can put your hand in the air, or we can close the session.
If I could just don't care. Sorry, couldn't help myself.
I was thinking about speak Portuguese. You are in Portugal. It was so common.
Exactly. Horribly common, that sentence. I am maybe going to stop recording.